Do you suffer from interstitial cystitis? Have you gone through various labs and various tests like cystoscopies or ultrasounds or urine testing or urine concentration testing, and the doctors cannot find what's going on with your bladder and give you an answer why you have such an urgency and frequency symptoms on a regular basis? Have you tried medications, anti-inflammatories like Elmaron or other anti-inflammatories, or had some injections put into your bladder to try to stop these painful episodes or discomforts that are going on in your lower abdomen, bladder area? Have you taken antibiotics on a regular basis in your past or in present for what the doctors thought was a urinary tract infection, whether they found a urinary tract infection in a urine test or whether they could not find it but still prescribed you an antibiotic anyway because they had no other tool to be able to assist you to help you feel better? My name is Dr. Lonnie Herman, and I've got great success with helping women and men overcome their interstitial cystitis symptoms and have normal function again in their lives. And in this video, I'm going to be reading off an email from a female patient, middle-aged female patient, who reported to me in two separate emails, and I'm going to be very clear of what was going on in between, and the email speaks for itself, or both emails speaks for themselves. But I had reported about this patient in a previous video where she had, after her first protocol with me, she had 60% relief of her interstitial cystitis symptoms. She had continued to experience the 60% relief of these interstitial cystitis symptoms after her first protocol. So I'll put a label at the bottom of the screen here where you can go back and watch that video and understand what I had uncovered in her first protocol that brought her the 60% relief of symptoms. And I also discussed in that video about her second protocol, which was before she started that protocol. I made this report in this other video where I examined her excuse me, on January 16th of 2017. And she started that protocol within a few days after the January 16th of 2017 examination, where I had found and had her follow a very unique protocol to remove infections from her bladder and from her urethra and ureter, her endometrial tissue, her vaginal tissue, her cervix tissue, the ovaries, the fallopian tubes, her stomach, as well as nerves that go to the bladder. And there are some other parts of the body that I don't have to cover in this right now. Again, you'll be able to refer to that other video and watch that one. I want to make this video short and to the point of what her progress was that she reported to me. In her first email, which I received, her first email responding to us about her excitement of what her, and I'll show this on the screen to my left side here, I'll put that up there. I will block out her name and her email, so I'm not letting out any personal information. But March 20th of 2017, shortly after her protocol was complete, here's the highlighted part of the email I want to share with you. I did not have any improvements at all after I left, leaving the office here for the exam. So I didn't feel like anything was going to change right away. And she says that after she left, she was getting very discouraged. In fact, I felt like I was digressing a little. There were no major episodes of interstitial cystitis pain and urgency like there used to be. So obviously there was improvement, but she was still feeling, she says, but some small aggravating times of the day where the urgency and need to go were constant. But after I finished the strep protocol, so part of the protocol, my protocols are designed for each individual finding that's going to remove each individual infection and or toxin from a specific tissue. So it's unlike when a patient goes to a doctor and starts taking anti-inflammatory and they might start experiencing relief, total relief of their pain, if they can experience relief from their pain or symptoms that day or within the next day. Every step is designed to remove another piece of the puzzle. So if you have 10 pieces of the puzzle and you remove 1 or 2 of them, you still have the other 9 or 8 pieces that you have to solve or remove in order to experience complete relief from the symptoms. Hopefully that makes simple sense for you. So again, back to her email. But after I finished the strep protocol, I think it was around 5 or 6 weeks into taking the remedies, I had a major shift. I think this was the day that I took the strep remedy every hour, 7 times throughout the day. After that, I had no more urgency and frequency. Again, I had no more urgency or frequency, and I have felt great since! Exclamation point. If I drink a tad too much coffee, I will need to go more, so I cut back on the coffee to just a few sips. The coffee causes, just to get out of her email for a second and help you understand, coffee creates dehydration. It's going to make you have to go to the bathroom. You drink coffee, you're going to have to pee more, period. There is no way to stop that. That's because coffee causes dehydration and makes your body remove fluids, so you're going to have to pee more when you drink coffee. So she said, so I did cut back on the coffee, and this has also improved her pain and urgency. I'm only going once per night also, which is huge for me, as normally I will go at least 2 to 3 times per night, and usually between 8 and 10 p.m. I go 3 to 4 times before bed too. So there is none of that now, she says. None of that. Her urgency gone, her frequency gone. She also continues to say, because there are other parts of the protocol to help her with certain emotional issues, my energy and focus is also improved, and I just feel much happier and more joyful. And not as irritated and annoyed by everything and everyone. My sugar and caffeine cravings are better also. So that's fantastic. For a person who suffered, this woman suffered from interstitial cystitis symptoms for 5 years of her life. She had started experiencing for probably about a decade or so, somewhere around that, maybe even 15 years, somewhere in that range, prior to her interstitial cystitis diagnosis, initial diagnosis. She suffered for urinary tract infections since she was 24 years of age. I'm going to tell you a little bit of insight about this person, and you haven't met her yet, and she's not on video with me yet, and hopefully in the near future she will be, to help you really understand from her speaking for herself, to help you understand that this is reality, that this is possible, that you can, and I can help you stop your IC condition and have normal function again. And that's without a drug and without cutting anything. It's by finding and removing safely and effectively, removing those infections and toxins that cause the condition. And I can find it with a very unique bioresonance testing that I perform. And no, if you look up bioresonance, this is not a computerized electrical machine. This is all a very skillful, hands-on type of stress reflex type of examination, where I can find and help you safely eliminate the causes of your interstitial cystitis condition. And if you want to know the percentage of people who are getting better, everybody, anybody who's willing to do what it takes with me, for me to help them get well, you, they, your loved ones, your friends, your parents, whoever child can and will recover from interstitial cystitis, whether it takes one visit with me or more than one visit with me. But I want to be clear about this patient. I'm going to read another email in just a second. In her initial consultation with me, before we first started care, I discovered in her history that the first time that she had her first urinary tract infection at 24 is when she was first with her husband, her first intimate relations with her husband. Now, this is in no way to say there's anything wrong or bad about her husband or dirty about her husband, but I'm going to be clear about something. There are times that men and women can hold infections, children, men, women, adults, elderly people can hold infections in their body and have no idea. A man can have an infection in his prostate without having an inflamed prostate problem, can have an infection in the prostate that gets into the sperm fluid that will come out during intimate relations. And that will be deposited into the woman, and that infection can now cause a symptom in a woman. A man can have an infection in any of his reproductive tissues, in the sperm cord, in the testicles, in the urine bladder. There could be anywhere there's infection in a man's body that carries through or is transferred over to the woman's body, and that will cause the woman to have a problem. There's ways that men can get infections, and it's not just from having any kind of intimate relation with another human being. We can get infections in our bodies through things that we've eaten, through having an infection in a cavity in the tooth, or gum infections can actually get down into the kidneys and into the reproductive area and get in and then be transferred over to another human being. So this doesn't mean that the person slept with another person who was not a clean person, although there are people, many people, who have infections in the bladder, in the female reproductive tissues, male reproductive tissues, and don't even realize that Candida can be transferred across. Lyme infection can be transferred across. Strep bacteria can be transferred across. Strep bacteria does not only exist in the throat where we find what we call the strep throat. You can have any kind of bacteria, any parasite, mold, fungus, even viruses, and other chemicals like mercury and other types of harmful substances, insecticides and pesticides, anything that we've consumed or that we've been around or that we've been involved with from another person, drank water, in the air that we breathe, food that we eat, vaccines that we've been injected with, medications that we've taken, any kind of illegal drug somebody has done. Any of these chemicals and infections can be in the body and can be transferred to another human being. So initially, when I first spoke with her, I said, I have a feeling that you got your first symptom because of being with your husband, at the time who wasn't her husband, in those early days in their relationship. But I said, if you could, please refrain from any kind of intimate relations during your protocol, because we want to make sure that you can resolve your symptoms with this work and that you're not going to keep having an injection, so to speak, a transfer of infection from him. If he does have this infection or multiple infections that he's transferring to you that keeps on creating or adding the fuel to the fire, we need to stop that from happening so we can actually find the point where you're relieved of your symptom. And that's what she did. She refrained from any kind of intimate relations with her husband through the protocol. So again, back to this email, she says that once she took a certain part of the protocol, she had a major shift. She had no more urgency, no more frequency. She was really happy. All the frequent urinations at night and before bed and throughout the day, and the pain, the discomfort was 100% gone. Now let me read the next email that she sent. So that email was on March 20th, and this next email that we received was on April 19th, almost 30 days, maybe 29 days, but after that other email. Here's what she said. I know I have an appointment for late June. However, I'm not sure if it's still a good idea to come down. Listen, and that was because what I say, and I'll read the rest of this email, because, or parts of this, you don't have to know every personal thing about this person, but what I'm going to tell you is that, and I'll block out some sentences there only because you don't need to know every personal thing about this person's life that she shared with me. But I'm going to tell you that there are times when I help a woman overcome a condition like interstitial cystitis or endometriosis or other kind of female reproductive tissue issue symptoms or bladder issue symptoms. We need to, at times, meet also and examine the spouse or the significant other, because we can have a transfer. I'm going to be very clear and very blunt and very straightforward, and hopefully if you're not mature enough to listen to these points I'm going to make right now, then please turn it off, because it's just something that human beings are involved in when we have intimate relations with another human being. Open mouth kissing, you can transfer infections through your saliva. There can be infections in your gums you don't even realize that are transferred from the saliva to another person, and they can be swallowing those microscopic infections that get down into the kidney and to the bladder. Point one. Two, if there's any kind of, besides intimate, intercourse relations, which can transfer infections back and forth from male to female, or female to male, or whichever way that you go in your life. And then there's further that if there's any kind of oral sex, because if you have an infection in your mouth or somebody has an infection in their private parts, then it can be transferred back and forth from mouth. And it doesn't have to be a syphilis infection. It doesn't have to be a gonorrhea infection. It doesn't have to leave warts on your lips, your mouth, or in the genitals. You can have strep bacteria, staph infection. You can have E. coli bacteria. You can have any of these kinds of different bacteria or parasites or molds or fungus that can transfer from mouth to reproductive tissues or reproductive tissues to mouth. Just understand, any way you have an intimate relation with another human being, it can transfer. Fact, period. So she goes on to say, because she was considering if she's not sure to come down, she'd like to hear my opinion on this, because after the first round, she had a lot of improvement, 60%. But she was still having some urgency and pain. She goes on to say, after the second round of remedies, I was still having no improvements until I think a certain week where she took the strep infection around day 30 or 40, and then she had not one single symptom, exclamation point. I was thrilled, she says, which I'm showing this on the screen here. I reported back to you all of my success. During this time, my husband and I decided to refrain from sex while my body was healing. At the beginning of April, however, which was couple of weeks or so, or so after she had experienced 100% relief, had no symptoms, she was feeling great. She said, at the beginning of April, however, we had sex, and a day later, all of my symptoms came back and hard, and they have not left either. So that's all I'm going to share about that email. So my point here is, there is, which you can tell from there, most likely there are infections that he's transferring to her, and this is in no way saying anything bad about this man, because if a person, when a person doesn't have a symptom, doesn't have a rash, doesn't have a fever, doesn't have a runny nose, doesn't have a sore throat, doesn't have any kind of swelling, doesn't have any kind of warts or some other kind of, ulcerative problem on their tissues, they think everything is okay, because if it's not broke, people use this term, if it's not broke, don't fix it. So if somebody doesn't have a symptom, burning when they go to the bathroom, or some other kind of symptom, they think everything is okay. But the fact remains that people can have infections and have no symptom for many years to come. Who knows, maybe this gentleman, who could be a very clean and nice individual, but maybe this gentleman, when he's in his 50s or 60s, all of a sudden has a prostate hypertrophy problem that had been developing for the past 20 or 30 or 40 years. Because maybe the infection that could be in the prostate that is not causing such a severe prostate hypertrophy or swollen prostate, maybe he doesn't have that symptom now, but the infection is growing in there to the point where it's going to be that swelling, where they're going to have to do a biopsy, check for cancer, and do some other procedure, or just say, or running his prostate analysis and a blood test and say, oh, you're good, oh, you're bad, and let's just recheck it in a few months. Infections get into the prostate and they will cause the swelling over years. So maybe, just maybe, he has no symptoms now, but she, very clear from that email, she was 100% free of her IC symptoms until she had intercourse again with her husband, and right then, the very next day, full-blown symptoms again. So, you're never going to have a cure. What you have the ability to do with me is to help you find what's causing your symptoms. And if a loved one is contributing to your condition, we have to clean up his or her tissues as well as your tissues and clean them. And with these remedies, with this very unique work that I perform, I do every day, we will be able to find and remove the infections. Again, she had 60% relief of her symptoms that remained consistent after her first protocol. She had 100% relief after her second protocol with me. It remained consistent, 100% relief, feeling great for the next 2 weeks until she had sexual relations with her husband, and then full-blown symptoms again. So when I do get to see them in the future, and they will be coming back, and she wants to come back, but there are certain other factors in life, I don't have to get into her personal issues, certain factors in life that are delaying the visit with me. But for the first time in many years, she finally has experienced that she can experience relief and live and enjoy the relief and not the pain or urgency or frequency. So I can help you. You'll find my number at the bottom of this video, 954-370-3100, 954-370-3100. You can also email my very happy to help you friendly assistant, scheduling assistant. I put the email address at the bottom of the screen here, and share this video with a loved one, share it with a friend who is suffering with interstitial cystitis or chronic urinary tract infections, or both. You can get well. Look forward to another video that I'm going to be putting up soon, about another part of the nervous system that can also be connected to interstitial cystitis or causing these frequent urgent symptoms. I'm here to help you. I can help you. Whoever is really looking for the answers, they're right here. You can get well. Further, like me on my Facebook page. Go to my Instagram as well if you want to look for other information that I put up. Subscribe to this YouTube channel where I put these videos up. You can be the first to know that when the new videos are put up, you'll get an email, you'll get a notification that there's a new video to watch. I help people with all different kinds of conditions get well. I look forward to helping you.